our line or our own radiosurgery line, which is 212-CHOICES, 212-CHOICES, which is 212-246-4237, 212-246-4237. Interesting article this week written by Dr. Douglas Wood and Dr. Ella Casarini, talking about why is Medicare refusing to cover lung cancer screening. Now, screening can save lives. We know for cervix cancer and mammograms and colonoscopies, screening saves lives. But why doesn't Medicare cover screening lung cancer's possibility? If you could save thousands of lives, they write, Dr. Wood and Dr. Ella Casarini, would you do it? They estimate that 14,000 lives a year would be saved by Medicare patients alone if Medicare would cover it. And most patients are discovered when, unfortunately for lung cancer, it's too late for a cure. So the reason to have early detection is to find the cancer early. So why doesn't Medicare cover lung cancer screening? It covers breast, covers colon, covers prostate, but why not lung cancer? And especially 70% of lung cancer occurs in the Medicare population. So there was a national lung screening trial, which was the largest and most expensive clinical trial ever performed, funded by the Institute of Health. From 2002 to 2010, they evaluated low-dose CT scan on 53,000 people and showed a 20% reduction in lung cancer death. The data was published in 2011. The United States Preventive Services Task Force agreed and recommended lung cancer screening. Under Obamacare, the recommendation requires private insurers, not Medicare, to provide lung screening. Can you imagine this? The government is recommending and requiring private insurance to do it, but Medicare doesn't. Wow. Sounds like hypocrisy to some people, like to me. Don't you want to keep people alive, healthy, avoid fatal cancers? So if you can make a policy, as the writers say, that could save the lives of 20,000 Americans of all age, what would you do? They say the decision seems easy. Lung cancer screening can provide the next significant victory in the long war on cancer if it gets approved for everyone. So speak up. Why is Medicare not moving ahead? And speaking of, we have a caller from New Jersey, so good morning.
Good morning, Dr. Lederman.
How are you today?
I'm fine and hope you're the same.
Thank you.
I listened to your program earlier this morning, and about 1 to 1:30, whatever the
1:30
time
to 2:30 and 3 to 4. We have 5 shows every weekend. 1:30 to 2:30, 3 to 4 on WOR, and then this program, and then one at night, 9 to 10 p.m.
And I try not to miss any of them.
You shouldn't. They're so important.
They are.
And the moderator is so sexy and intelligent.
Okay. I don't know.
I'm just joking.
Well, anyway, the thing that I wanted to mention, on one of your earlier programs, you had mentioned a number of times that lumpectomy of the breast is far better than mastectomy.
Well, there's data now that shows that women who have lumpectomy and radiation live longer than mastectomy. And I know it's opposite of what many people think. They think if they remove the breast, they're home free. And the problem is not so easy.
Well, to me, to have radical surgery like a mastectomy, I don't know why anyone would think that would be better. But anyway,
I just want to mention what I think. I think sometimes women think that if they remove the breast, they kind of make a compact with God. If they remove the breast, they'll suffer the loss of the breast in exchange to live. But the problem is, it's not true. Women who have lumpectomy and radiation live longer than mastectomy.
Now, the question that I really wanted to ask, knowing what I do about radiosurgery, because of...
We call it radio zapping. A lot of our patients like to call it radio zapping. They're afraid that radiosurgery misleads people to think it's surgery, which it's not.
I agree 100% on that one.
Or radio beaming.
Well, either one works,
Okay.
radio beaming or radio zapping. But what I was going to say, with the lumpectomy, I wanted you to comment, wouldn't radiosurgery be far better than even lumpectomy?
Well, the data isn't in on that. And I actually have women that we do radiosurgery on their breast. I have a whole group of women. You can't imagine how many women are out there they know they have a lump in the breast and the lump is growing and they're just afraid or embarrassed or ashamed to come to the doctor. And I urge those people to get worked up because we can probably save their life or have a chance of saving their life. And just staying home letting the cancer grow is the worst. So I agree with you that there are a group of women that can refuse surgery. We do radiosurgery in them. But the whole point is treatment is better than no treatment.
Right. Absolutely, as soon as possible, that's for sure. Yeah. I had another comment. You had a caller named John. I cannot believe that the medical profession was going to remove how many of his organs?
It happens all the time. And, for example, bladder cancer, he had bladder cancer, so they're removing the bladder and the prostate and the lymph nodes. And data shows if you have bladder cancer, you can have equal results and keep the bladder. And I can tell you that people who have their bladder removed have, in general, a very poor quality of life in comparison to most of us who have a bladder that works and can urinate when they want. So, yes, he came in. He's getting a little chemo to sensitize the cancer to the radiation, and radiation focused on the bladder.
And you even mentioned the liver, and I thought another organ as well.
No, he said that, but that's not actually true. He said the pancreas. No, they weren't going to take out the pancreas. The bladder's next to the prostate, so usually for men they take out the bladder and the prostate and the surrounding tissues. But it destroys their urine life, it destroys their sexual life, it destroys their way of life because they never are able to urinate normally again.
Right. Again, I can't imagine why anyone would consider radical surgery on anything pertaining to cancer when radiosurgery is so phenomenal and you have such a high rate of success.
You speak about it like about it personally.
Well, I was going to say that next. I didn't know if you had a comment before that, but I was going to tell the radio audience that I'm very familiar with your office and your procedures because I had a friend who, before I tell that, I'm going to back up a little bit. Before I found out that a close friend had cancer, I had been listening to WOR often, and you used to have a commercial that you had on frequently, and you kept saying to hit the cancer, hit the cancer. And I heard that so many times, to hit the cancer. And so I listened very carefully, and I thought, God forbid I or anyone, that I cared about ever got cancer, but if they did, this was something I was really going to look into. So I sent for your free DVD and your booklet, and I examined them closely, read them, and so forth. And then all of a sudden, a close friend, I found out, had cancer. So I mentioned, your whole system there and your procedure and whatever, and so I came with a friend, and the office and your staff and everything, it was phenomenal. And we would sit in the waiting room while he was getting the treatment and whatever, and we would talk and laugh and have the best time. And the people who came in, instead of being in terror like most people are when they get cancer, and of course that's a valid thing, I would be as well, but when they come to your office, they lose their terror because you can, with God's help, we'll say that first, with God's help, you have such a high rate of success that people just have such hope. So I was just going to say that I don't know who's listening, but whoever it is, make sure they come to Dr. Lederman first.
I have a question for you. We hope people have more than hope. We hope they have results, and I hope your friend had results, not just hope, number
Doing
one.
Very, very well.
And number two, I don't know if you heard my comment at the top of the hour about the doctor who walked around with a clock and saw people by a certain number of minutes and then would leave when the minutes were up. I just wondered what you think about that compared to what your friend's experience was. Did they have
Well,
enough time with the doctor and staff? Did they ever feel like the doctor ran away from them? Or
I missed hearing what you said about that, but when we came in and so forth, if we had any questions, we got answers, and the staff is just wonderful. They're just loving, caring, very thoughtful and attentive people, and you couldn't find a better group. I think it's phenomenal. And as you've said, and I don't think people really maybe understand, that whole staff is working for you personally when you have cancer. I don't mean you as the doctor, but I mean people as the patient.
Right.
And so everyone is working together as one team every time you come in.
Well,
and
I tell people that, I don't know how you feel about it, but I tell people the patient is the boss, not us. And we try to direct our attention to the patient, not us.
Well, you've had, phenomenal success, and I think really you're very humble, and people don't realize just, how much success you've had. So I hope, as I said, anyone who, gets cancer or knows someone that has it, please, as you say, don't wait. Get in to see you immediately, and when they are finished having you review their case and know the possibilities, it'll take the terror away, and you can, with God's help, you do absolutely phenomenal things. And the real shame of this all is that it's not known by everybody. It's not known by very many people.
Well, it's a secret. It's a well-kept secret.
Pardon?
It seems to be a well-kept secret.
I know, and that's why I say I don't know why anyone would choose radical surgery over this phenomenal zapping.
Well, because you have a whole industry. You have an industry of hospitals that have operating rooms and beds and nurses and surgeons, and they want to use them. So they push for surgery, just like some of the cases that I've discussed during today's show and other shows. There's a pressure. Here, we work for the patient, not the hospital, not the CEO, not the surgeon. No, our boss is each patient.
And we saw many of those patients, and we saw them being, not during their treatment, but before and after their treatment, and they walk in smiling, and they walk out smiling, and improved, and I keep listening because I enjoy hearing you tell about some of them that were there, just beginning to come when we were there, and the success rate and so forth, and how well they're doing. Really exciting.
God bless you, and thank you for calling.
Thank you. Bye-bye.
Bye now. If you have questions or want to make a comment, please call us at the same number, 800-321-0710, 800-321-0710. We're going to go to our break. We have a word from our sponsor, and we'll be back in a moment with more news.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. Just want to mention a woman we saw, 61 years old, married from Albany, drove in with her husband. She told us she was dying.